We've walked through the first steps of this movement analysis, and we've come to the conclusion that the downward force of gravity minus whatever the upward force from the treadmill is, the upward anti, in quotes here, anti-gravity force from the treadmill, that net effect is going to create a flexion torque about your knee joint, and then the action of your quadriceps muscle is going to work against that by creating an extension torque about your knee joint. And if you're trying to push off the ground, that needs to be bigger than that. Now, given this information, we can start looking at the next steps in this analysis, which is what are the lengths of the muscle fibers involved? And in this example, that would be the quadriceps muscles. What length are they likely to be at? Now, to actually know what the length of a muscle fiber is, you need to use some kind of sophisticated software like I've been using in this class to estimate it. But as a general rule, if a joint is really flexed, like say you've bent your knee all the way to be like this, you could probably safely assume that because your quadriceps are going to be very, very stretched out, right? If your quads are going up like this, then the muscle fibers are likely to be very long. And likewise, if you're in a situation where maybe your knee is completely straight, maybe the quadricep muscle fibers are either closer to normal or maybe even a little on the short side. We saw in problem set 3, for example, that in the bicep curl, when your elbow is really, really flexed, the bicep muscle fibers are very short, because what's going on there is, like, if your elbow is like this and the bicep goes like that, at this position, the muscle fibers are very, very short. And we also saw that if you extended your elbow out to here, that would stretch out that muscle and lengthen the muscle fibers beyond their optimal fiber length. Now, in this case, if you look carefully, and maybe I'll just erase just for a second so you can kind of see what's going on with the knee joint. The knee is mostly straight. It's not all the way straight. So I think in this case, probably we're likely close-ish to the optimal fiber length. So we're not going to get too many major detriments in our muscle force production as a consequence of being at too short or too long of a fiber length. You probably remember in problem set 3 when we were looking at deep squatting, when you're really deep in a squat, your glute muscles are so stretched out that you're far beyond the optimal fiber length, and that inhibits your ability to produce force. So then we can move on to part 8 of this procedure here. Is this exercise isometric, meaning do you just stay the same position, like in a wall sit or something? Probably not. Running's a pretty dynamic activity. And we could think about, is the muscle, the quadricep muscle, because that's what we're interested in, is it going to be operating concentrically or eccentrically? Well, it kind of depends, right? When you're on the way down, meaning when your foot hits the ground and your knee is starting to flex, then that's eccentric. It's sort of like the down phase of a squat. But then when you're pushing back up off the ground, it's going to be concentric, right? So depending on whether we're thinking about maybe that initial phase of hitting the ground when you're still kind of going down, and the second phase where you're pushing off, that'll be eccentric on the way down, concentric on the way up. In terms of the difficulty or the challenge of this exercise, the reason to think about it here, the reason we want to think about concentric versus eccentric is because of the force-velocity relationship. So we could surmise that on the way down, you won't have to activate your quadriceps as much because of that eccentric force amplification. So if you remember in eccentric contractions, and I recommend you check the force velocity curve on that little muscle cheat sheet that I posted last week, it'll show you that if you have a muscle that's contracting eccentrically, you can, for a given activation level, you can produce more force than if the muscle was isometric. And the opposite is true for concentric contractions. So when you are concentrically going on the way up, so when you're pushing off the ground, that's the concentric contraction of the quadriceps. That's probably going to be the most difficult portion of the stance phase from the perspective of the quadriceps, because they'll have that negative effect of concentric contraction. So number 9 here, how will the range of motion in this exercise affect external forces and their moment arms, as well as the fiber lengths and the fiber muscle moment arms? This is this was essentially the topic of problem set 3, where we saw that in when you squat down really deep, not only do the muscle fibers get too long, but also you have this gigantic moment arm of the weight of your body and the weight of the barbell also about your well, first your knee joint and also your hip if you squat maybe forward like this. There's this, and then there's the moment arm like that. So in the case of running here, the knee joint is going to flex when we're on the ground, right? Because you hit the ground like this, and then your knee flexes a little bit more, but it's not crazy. It's not like you're going down to 90 degrees or anything. So what's going to happen? Well, when your knee is the most flexed, that's going to be the point where the muscle is stretched out the most, and it's also going to be the point where the moment arm of your body weight minus the upward force of the treadmill from up here is the biggest, right? Because that moment arm here is pretty big, but if your knee was really straight like this, then moment arm gets much smaller if we consider body weight coming from right here. So we might start to build some intuitions here that two things that are going to make this this exercise, taking one step of running, difficult are, number one, when our knee is most bent because of the influence of the moment arm or the external force, and also that's the time when the muscle is stretched out the most. And also when you are extending your knee on the way up because of this concentric contraction. So we're already thinking that probably this factor is gonna, especially the external force moment arms, is gonna be important. Now the external forces aren't gonna change because your body weight obviously stays the same, and the upward force from the treadmill, at least, is supposed to stay roughly the same. But you may encounter some activities where the external force does actually change in different conditions or as a function of as you go about the exercise. So, is the body's muscle activation strategy likely to be abnormal for any reason? Now, I bring this up because, and in fact, these last 2 or 3 points give us information that might make us deviate from our normal kind of assumptions about how the body's going to operate. So this will be most relevant for maybe people who already have an injury. So if this runner already has a patellar tendonitis, maybe they might be preferentially using their other leg to push off the ground, and kind of adopting a limp because of pain, right? So what might change the activation strategy that the body uses? Well, pain, injury. Neurological conditions like having a stroke or having cerebral palsy. Maybe we can say neuro conditions. Also, and maybe we could say training status. And what I mean by that is if you're very inexperienced, you are not likely to be very effective at activating your muscles the best possible way to perform an exercise. Also, you might just have muscle weak. You might just not be very strong, so you might just be weak muscles. So if that were the case, your body would have to start searching for other muscles that could also contribute to the motion. Now, less relevant here, but more relevant, say, in one example I know is at the hip in runners. If your glute max and glute medius are weak, your body will start searching for additional ways to extend the hip joint, and it will start using muscles like the TFL and the piriformis. And it needs to do that because it can't produce the torques that it wants, because your primary hip extensors and external rotators and abductors are too weak to get the job done. So this is just something that will be useful to keep in mind, especially when you're working with either people who are inexperienced, people who have muscle weakness, people who have some type of disease, people who are in pain or have some injury. Likewise, number 11 also is going to be specific to people who maybe have developmental disorders like cerebral palsy. Quite often what happens is not only do they have various kinds of musculoskeletal problems, but the actual structure of their body is different. So their muscle moment arms are different. You saw in one of the articles we read, their sarcomere lengths are different. And that might bring you outside the normal range of things of what you would expect based on everything we've talked about up here. Lastly, number 12, this is kind of open-ended, but sometimes you run into situations where you might this kind of analysis might not give you 100% confidence in what the answer to your key question is. So for example, if you were interested in, is this athlete limping, or do they have some abnormal muscle activation strategy, you might be able to use something like EMG, electromyography, which we'll talk about, to uncover what their muscle activation strategy really is. So given what we've talked about here, what is the influence of this treadmill going to be on the demands on the quadricep? That was our original question. Well, because the overarching situation here is the quadricep muscles are activated to produce a knee extension torque that counteracts the knee flexion torque caused by your body weight. The bigger this force is, the less of a flexion torque you get from your body weight. Because again, remember, this force here is your body weight going down counteracted by the alter G force going up. And so the less of a knee extension torque you're going to need to overcome the knee flexion torque. So in other words, if you crank this up to, maybe don't support me at 80% of my body weight, I only want to run at 60% of my body weight. I want to make this here maybe smaller. Then the same force, a smaller force gets multiplied by the same moment arm and creates a smaller torque, because if you remember, the torque induced by a force is just the product of that force times the moment arm. So generally, things like this, assistive technologies, are going to be changing forces somehow, or they're going to be augmenting the torques at a certain joint. A few of you were interested in exoskeletons or knee bracing or other kinds of things that could also maybe add some assistive torques like this that would reduce the amount that you had to use your quadriceps to create knee extension torques. So this is a little involved, but hopefully you can use this step-by-step procedure, as well as the additional details in the lecture notes that we just talked about, to analyze different exercises that you may encounter out in the field, in the clinic, etc.